Hello, good evening. Now, you'll have to bear with me this evening because I have sort of been thrown at the deep end. I have been reading around the care industry, but I'm sure you all know a lot more about it than I do, and the panel certainly does. But I wanted to get some idea of some of the issues that are facing this particular industry, and there seem to be many which have been going on for a long time, and hopefully tonight we can actually come to some positive ideas of how we can move things forward and change the dialogue, which is what I'm supposed to be doing. So I won't tell you anything about me because that's not what I'm here for. If you want to know anything about me, just Google Colin McFarland. But for the moment, what I'd like to talk to you about is the panel. So I wish there was a little bit more light, but as there isn't, excuse me while I put on my shades. Right, here we go. So I want to introduce you first to Claire Parker, who was on the end here. Claire is the Carers support team, and she worked with the Carers service over the last 9 years, has seen it grow and evolve. Look, let there be light. And has seen it grow and evolve through consultation with the Carers of Lincolnshire. Claire currently co-manages a team of 19 support workers, providing a telephone-based assessment and support service. Claire also coordinates the Trusted Assessor Network and provides quality checking and training to approximately 70 trusted assessors. I was asking Claire earlier questions about how do you know who to go to get assessed, and hopefully she can explain that to you. Justin Hackney, where's Justin? Hello, Justin. Justin is at the Lincolnshire County Council and is head of Lincolnshire Clinical Commissioning Groups. Justin is the Assistant Director for Joint Commissioning of Specialist Adult Services, Learning Disability, Autism and Mental Health, and I understand Justin is the man with his hands on the tiller. So they tell me. So they tell me. So any change we want to make happen, we have to try and direct it this way. Katie, who I met last week at the Carers Day, was that last Friday? And Katie works with Spurgeons, who are a young carer service provider organisation. And Katie regularly speaks to schools, organisations and agencies raising the profile of young carers, some of whom I met last week, and I understand don't get a lot of recognition from either schools or GPs. Again, something we need to look at trying to change. Kim, to my left, Kim Katanori is a carer who has the lone parent carer of 2 teenage sons on the autistic spectrum. Kim's an advocate of parent carers and takes every opportunity to raise their profile. An enthusiastic supporter through her volunteering role with the Carers Partnership, Kim also encourages any carers to support the activities and partnership review days facilitated by the Carers Partnership. She feels they provide empowerment and encouragement to all carers. And as you were saying to me earlier, you have so much on your plate, it's quite hard to keep all these things going, but that's another area we need to discuss about how we support carers. Liz, where's Liz? And here's Liz. Liz is from the Department of Work and Pensions, so anything to do with benefits, we address to Liz, who was telling me earlier that yes, it's so complicated, most of her job is trying to explain it all to people, so hopefully she can do some of that for us today. What does it say? Let's read what it says about you, Liz. Partner Support Manager for the Department for Work and Pensions. Liz works with partners from both the statutory and voluntary sectors to provide benefit advice and access to the Department for Work and Pensions services for vulnerable people in Lincolnshire. Paul, on the left, is from the university, so he's from home territory. Paul Mansfield. He's a senior lecturer in social work at the university. Paul has over 25 years' experience of working in adult social care, including 8 years as lead officer for carers issues in Leicester. So Paul tells me about 3 years ago is when you sort of stepped out of the furnace, as it were, and you lecture now, but you have a lot more of experience and knowledge of this area. Tony, have I got to Tony? Have I done Tony? Are we missing? Yes, there's Tony, who I spoke to earlier. Tony is the person who has to give advice to this person over here, I've been told. A lot of consultation, lots of other things that you do. He was telling me how big his department is. I think, 300 to 400 people in your department? So Tony is Executive Director at the County Council and Director for Public Health for Lincolnshire. Tony also gives public health advice to the 4 clinical commissioning groups in the county. Tony is currently leading the work on health and social care change. Social care, urgent care centres in community hospitals, and fewer acute hospital beds. Tony said that the whole area of well-being is also a major subject that they have to deal with. And finally we come to the person who's responsible for getting me here, is Pauline Mountain, MBE, Lincolnshire Carers and Young Carers Partnership. I'm sure you all know Pauline. If you don't, you will by the end of this evening. She's the chair of the Lincolnshire Carers and Young Carers Partnership Board, and she is, as many of you know, a force of nature, and that's why I'm here, because she said you've got to come and help out, and I said, all right, if you ask me to, I'll be there. Now, Pauline wasn't a force carer herself, which is where a lot of her drive and passion comes from, and she set up the LCYCP in 2007. Is that when it began?
Well, it was a partnership under the local
Authority, and then it
sort of moved it out to become a strategic advisor now.
There you are.
So an independent organisation that takes characters and advises that.
Thank you. See you on. Well, that's your panel, and I understand we have some questions in the audience. Who has the questions for us? Would you want to kick off with one here? Does anybody have one before we go to our little list in front of us? Anybody desperately want to ask any of these wonderful people a question? We have, I'm sure you'll have loads in a minute once you've warmed up. Okay, let's kick off there. First of all, who are you and what your reason for being here is?
Yes, I'm a carer. I have 2 adult children who have needed care since they were 7 and 11, and they're now in their 20s.
Right.
So I've seen all stages through development of young people. But one thing that I find most perplexing really is that, and although we have very good GPs in many ways, the one thing that is never asked when I go to the doctors is, how are you? You're the carer, aren't you? How are you doing? It never has been asked. And I just wonder whether more could be done to put, the carer more in the spotlight with the GPs, because I'm sure we are carrying the weight of all that care.
We were discussing this earlier. Who was I talking to about GPs? Quite a few earlier. Frank's model, you were talking about. Who was I speaking to? I can't remember. Who wants to kick off with this one? Anybody know about Frank's model?
Yeah.
Yes?
Both of us.
Do you want to go?
You both do?
No, go on.
Who wants to go first? Claire, go.
Frank Frank's probably one of the founding members of the partnership and was extremely passionate about the subject of carer recognition within the health service, hospital discharge and GPs. And Frank has devoted an awful lot of his time to helping raise awareness. So there was actually a GP project that was commissioned 2 or 3 years ago now, I think, which was aimed specifically at getting GP engagement and improving that. So a lot of work was spent in contacting GP surgeries, liaising with them, attempting to raise the profile. It had mixed results. There are some surgeries that are absolutely fantastic, and they tend to be the ones that are fantastic at everything, and then maybe a few of the smaller ones as well. But the engagement was not as good or as strong as we would have liked it to be. It is an ongoing battle. But Frank's model basically is a series of layers of involvement with the surgeries. So Frank himself or other volunteers through the partnership will go into their own GP surgeries or local GP surgeries to help raise awareness with the doctors and partners, trying to get involved with the patient groups where they exist and where that is possible, to keep that work going and to try and have a visible care presence within the surgeries. It's an uphill battle, and I think it always will be, because there's turnover in some of the surgeries. Certainly my own surgery, I think we have 1 part-time permanent GP and the rest are all locums. So there's nothing in my local surgery.
So what would you like to see happen?
I think it would be ideal for GPs to have it flagged up on their computers when a carer has a consultation or is there on behalf of their cared for. Because there are other issues, around the timing that you can go to appointments, for instance. If they're running very, very late and you can't stay, because you've got to get back to your cared for. There are issues that require, if you like, a little bit more care for the carer.
I read a bit about Frank's model, and it covers exactly that point, that flexible appointments, flagging up that this is a carer, that it's going to affect the whole family, that there's a whole set of issues that everyone knows in the care too. Why, Pauline, you know more about this, Why do you think there is so much resistance from GPs?
I think one of the issues is obviously we're all individual, and I think when we go to a GP, we want something back, and without having almost a menu of options to give us, the GP's time it's so limited, isn't it? You know, and so it's almost like we need to make that separate appointment that goes in for us to say, I am a carer. And I think we've talked about this and the fact that is very hard, because you don't recognise that you are a carer, because you, Jill, are a mum. And first and foremost, I was a wife. You know, and so that's your role, that you're almost just getting on with what you're doing. And ultimately, it's a bit of both, really. Very difficult to... Sorry, can you...
No, it's good. No, I've got you. I was going to say, Paul, you were saying you had a lot of experience in the social care world. Yeah. So in terms of GPs, and because they seem to be a key plank of how to move the whole care industry forward, if the GPs can go on board, how do we...
Well, I mean, this issue about GPs not acknowledging carers has been around as long as the carers movement has been in existence. And it's one of these problems that the policy community name them wicked problems, not wicked problems. You know, they're not good problems. They're wicked problems because they seem to be almost insoluble. And one of the things I think we need to do when we get a problem that keeps recurring and despite repeated attempts doesn't seem to be moving forward, I guess we need to think about, well, are we banging our head against a brick wall, or do we need to do something different here? And my view about general practitioners is that the clue is in the name. They are general practitioners. They have very wide and varied responsibilities. And while I would not want to discourage people from developing good practice between carers organisations and GP surgeries, I think there may be a kind of natural ceiling to how far we're going to get with that. And I do wonder whether, rather than putting another responsibility on people who are generalists, general practitioners, we ought to be thinking about other parts of the system that carers connect with. For example, hospitals at the time a diagnosis is given of a particular illness or disability, and try and make sure that we're actually also hitting some of those more specialist corners of the health service, because I do worry that within the range of things that GPs have got to do, this is only one of 1,000 things on their list, and I'm sure if there was a GP in the room, that's what they would be saying. The reason, of course, why we can't give up on the subject of GPs is it's the place that most people go. So because GPs see more people, we do need to keep trying with the GP issue. But I do wonder whether we need to recognise there's a natural ceiling to how far we're going to get with that, and try and pursue some other avenues as well.
Well, think about GPs in a slightly different way, I suppose, in terms of how they... Because I think I was reading in the literature that I was sent that 79,000... There were 79,000 carers in Lincolnshire, which is 10% of the population, and that's only the carers that are telling us that they're carers. So have all the people who are just doing it because it's the right thing to do, and you don't necessarily call yourself a carer. So, and I think it said in 2037, half the population of Lincolnshire will be over 65. So clearly, this is going to be a problem that's going to grow year on year. So we need to have this debate now as to how do we change that? Because I agree with you, it's been going on for years, nothing's happened. Do we have to find a way of shaming our GPs into doing the right thing? But you know, it has to happen, because we're all going to be picking up the tab on people having nervous breakdowns and all the rest of it because they can't get help. Sorry, you had a question of it.
Just with you saying that, you have physiotherapists and chiropodists and podiatrists and things like that within the health centres and things like that. You could have somebody who is there, like a nurse practitioner, to talk to the carers, and if they feel there's a need to pass them on to the doctor, then make an appointment to pass them on, because at least they can be heard and taken on from them.
I mean, I think, I'm not quite sure where to start with this really, but I mean, one of the, I acknowledge exactly what you say, and I think it's not just about GPs, it's around a whole range of health professionals, in fact, who don't think about carers, and I can tell you they don't think about whole groups of other people as well. I think there are two important issues. The first one is, yes, there needs to be more flexibility around how they deal with people who are carers for the reasons that we talked about. There also ought to be a real interest in whether someone's a carer, because it might actually be a clue about what's wrong with them or how you might go about treating them. So it's important from that point of view as well. And I think there's two things I'd say. The first one is that, in my experience, the way to get people to do things is to teach them about it when they start their professional education. So I suspect, well, I know that a good few years ago, the medical curriculum had nothing about carers in it at all, and I imagine that it probably doesn't have a lot in it at the moment. So there is one way in which we could begin to influence the next generation of doctors who are coming along, so that they recognise that this is an important question to ask. And actually, if you want to catch people a bit later down the process, then I wonder, and I don't know the answer to this, I wonder how much in the GP's training scheme carers are ever mentioned, but I reckon it's not at all. So that's one important thing. What we're trying to do at the moment is to reorganise our health and social care systems in Lincolnshire. And that's because we actually think that there needs to be a lot more integration of the care that people get, so that they get a whole package and not just bits and pieces, so that as a patient, as a carer, you don't have to go to lots of different places and explain what's the matter with you and go through it all over again, that people will indeed see up on their computer that you're a carer. Now, it isn't just about carers, to be honest, but that is an important element of it. And so we're looking to put in place neighbourhood teams across the county who will cover a reasonably sized population. There'll be a number of practices coming together and working together with community mental health staff, with community teams like district nurses and health visitors and therapists and so on. And one of the things we are planning to do in that is to have a carer's contact, a worker in there whose job will be to link with carers, but also, and I think this is really important, to keep reminding all the health and social care professionals in that neighbourhood team that carers are important. So we recognise what you're doing. We haven't got there yet, but that is part of the plan for the changes that happen.
How accessible will that be for your average carer in terms of, you know, saying there's lots of different community groups? How do people find them? How does this work?
Well, the neighbourhood teams will be the main source of health and social care support for everybody in the community.
Right.
So it will include all GPs, all district nurses, all the community therapists, and a whole range of other people as well. And they will be the providers of health and social care to people in the community. And those people will, for the first time, I think, have someone with a specific responsibility around carers.
Does that help?
That helps, yes. Perhaps also in the GP's surgery there ought to be a corner, suggesting help where you could go to if you're
I'm sure there's all those sorts of things.
There's nothing at all in our GP.
And there's nothing at all there. Is that a common story of people going to GPs, not a lot of help? Or... Yeah, sorry, go ahead.
Norman Maskin from the Wellhead Centre.
Oh, hi.
Hi.
I remember you from last week. The wonderful respite care place. Yes, go ahead.
Yes, and we provide time and space for carers who are at breaking point, free of charge. And our experience is that we've contacted GP surgeries, and because we're not signed up, whatever that means, registered with the NHS, had already been closed. We do have some GPs on board with us, and we have over 140 referrers now from 3 categories: medical practitioners, pastors of churches, and another group which we term as community support workers, so any professional working in the community supporting people. And so we've asked if we can put flyers into surgeries, and we've not been very successful, I'd have to say. Yeah.
And that's because you don't think you're officially NHS, is that the reason?
Yeah. But to our friend down here who's saying, if that question, how are you, was asked, what we would like is to be flagged up as an option for someone who's tired. Because our experience is that carers who are caring for someone in the home, that's what both of them want to happen. So if the carer breaks, then that can't continue. So we want to
And it's also such a wide area, isn't it? Because you've got carers who are long-term carers who, to some extent, know the ins and outs of this world a bit better. Then you've got people who suddenly, your partner collapses of a stroke or heart attack or a brain tumour or whatever it is, and you're suddenly thrown into this world. So, bizarrely, being asked to do this in a way put me, my mother-in-law had Alzheimer's, like my wife went through all of that with her, so I saw a bit of that world. But actually just trying to read about the care industry in a very quick, short space of time to do this today, you're hit with so many organisations and so much information that if I was looking after my father or my mother, who thankfully still here, I'd be so consumed with the emotions of that. And it must be so draining for you as carers. I don't know how much headspace you have to go through all of this stuff. And certainly the thing that came to me reading everything was, why isn't it simpler? Why isn't there one point of contact that we can all go to? And little step-by-step guides as to navigating. And it all seems very complicated and quite alienating. And I think a lot of carers are already telling me when I was doing Pauline's conference last week how isolated they feel. And so I don't know how you're a carer. Can we talk about your experience?
And I think this comes back again to getting, Peter has put some facts and figures together which you can speak about, but like GPs, like anybody else, they're interested in what's in it for them. And perhaps we need to be showing what happens if the carer breaks down. So it needs to be seen as an investment in the carer instead of, oh, it's going to take another 5 minutes if I ask her how she's doing, and it's going to be 2 minutes over my time. So to see carers as an investment, we save the country billions. If carers are removed from breaking down, how much is it going to cost? So maybe if it comes down to dollars and cents or pounds and pennies, then it is an investment. And maybe those figures maybe the doctors and the GPs are not as aware as to the real cost of carers being out of the picture. It will cost more to
It's an excellent
repair.
point. I mean, Justin, do you want to come in on this as you're unfortunately in charge of this horrible world of money? Listening to what you're hearing here, how do we is there a way of, from what Kim's suggesting, of making it more of a financial equation to get GPs'
Or having
attention?
that mindset, that actually, by looking after this one person, I'm really, as a GP, who's sworn to care, that I actually am going to be helping maybe 5 people. So
I think
it's
the
not
primary
hassle.
is doing the right thing, isn't it, making it all joined up. I mean, money does have to be a feature of it, but it's actually doing the right thing. In a way, we do have a one port of call for the carer service already. It's the customer call centre in Lincolnshire. I'm not too sure if people could raise their hands if they're aware of it. Yeah. Does anyone know about the carers team?
Yeah.
Mark. I mean, that answers the question that I just raised, really. I think there's more to do in terms of promotion, not just through GP surgeries, but wider county-wide, really. There is a colleague in the audience that is actually the lead on this carer strategy, which is just being relaunched at the moment, which does actually give a great deal of information. Sorry, Emma, would you like to introduce? But have we got any copies of this that we could hand out?
I think the Carers Partnership would have brought copies, and
Yeah.
if we run out, then
Yeah.
certainly
Just before we take the
make it
next
a list.
question. Claire, did you have a point to make?
Yeah, I just wanted to say, I think the point that carers, there is so much information. Carers are bombarded in some ways, left, right and centre. In
Yeah.
other ways, they don't know where to go.
Absolutely.
And I think having a single point of access
That's what I mean.
is key.
Is key,
Because if
yeah.
there is, at the moment, you can see numbers for different organisations that are going to offer different bits and pieces. One of the benefits of coming through the carer service is that you've got one contact number,
Yeah.
and that person that you're in contact with will provide you with the information. But the problem is getting that number in the first place, so getting to that single point of contact. So if we can have one single number that's really well publicised, that carers know they can go to with any question, that is key to funneling the rest of the information out.
And also going with Kim's point about getting the help at the right time so that it doesn't become more critical, that you don't all, because once you aren't able to care because you're all stressed out, that's all we need you and your home for people to go and rest, but nobody knows about it because you're not included in the dialogue. So clearly there's a gap in the dots here.
Colin, there's a
Yes.
lady who wanted to follow up.
Go ahead.
My name's Trish Hargreaves. I work for Reading, and I'm a trust assessor.
You work for
Reading,
Reading.
mental health,
Yeah.
and I'm a trust assessor for Carers Partnership. Going back to the GPs, one of the things that was a common thread with many of the carers that I support is they are reluctant to go to the GP for what is when they're getting stressed or a bit overwhelmed with their care and role. And it occurs to me that we can go to a GP practice and see an asthma nurse, we can see a diabetic nurse, but we tend to associate the GP for something physical like an antibiotic or a headache. But when we want to go and talk about something that's overwhelming us, we can't do that in 5 minutes. And I just wondered potentially if there could be such a thing as an emotional well-being nurse, that it's second nature to go along and talk because you haven't got a 5-minute slot. And from that emotional well-being nurse, whether you're a carer or whatever's going on, they can signpost you to the right organisation that can support you further.
Personally, my GP is it's quite good because it's out in the middle of nowhere, so we have less people coming to it, so our doctors have more time to talk to patients. And one of our doctors is actually trained in mental health, but I feel like because it has less people, it has more time to invest in the people that's actually registered to the practice. So it would be helpful for there to be a similar line to maybe the 111 NHS line, where it's just call up, describe how you're feeling, what advice could be given, rather than, then that would help the carers that don't feel like they could go to the surgery, because they would have a voice on the phone at any time, and they'd get advice on how to deal with the stress and where to go if it really is quite bad, and what to say to get the help.
Thank you, Trish, because again, if I go back to the, I don't know, do you know of the SIRS, the Carers Emergency Response? If we go way back to when that was originally started to be put in, it was not in operation, it was a starting point, and they discussed about care emergency response, and they only talked about a physical emergency. And the pebble in the pond, and the lady sat next to you was at the same meeting, and I said, what about the emotional well-being? And that goes back many years, doesn't it? And we still, whilst we do it, maybe we don't publicise it as much as we should, because I think Claire will back me up on this. Your trusted assessors and whoever has carried out your assessment is that point of contact to go back to say, I can't cope, I need to talk to you, I need something. And in the dire emergency of I really can't cope and I'm up the wall and I need to get out of this room, then it is your carer's emergency response to have that as a point of contact.
Jackie Jameson from Horncastle. The only problem I can see with having an emotional well-being person is that it's yet another tier in an already overstretched mental health area. I mean, at the moment, my daughter, 17 months to see a psychologist. And in the meantime, they're going to teach her to put a sticking plaster on it. That's not good. Not when she's going into meltdown every 6 months. You know, and she's a carer, I'm a carer. I can't go into meltdown.
It's not an option.
Because, it isn't an option. You cannot be ill. I was recently hospitalised overnight. And
So what would you like to see happen? I know we can't just wave a magic wand, we can start a conversation.
I would like to see, the government are always saying that they're throwing money at mental health. Well, it doesn't seem to be getting down to the grassroots. I don't know where it's going, but waiting lists within the mental health system are getting longer and longer and longer. I mean, I've been doing this for 20 years, and in that time, I only actually became a carer about 6 years ago. Before then, I was just his wife. You know, it is getting better, but it's so slow.
Anybody else's experiences of the mental health side of it? And lady nodding up there. What's your experience of this?
Well, from anything from getting your child diagnosed to being told there's nothing left for you, that's it, go home and deal with it.
And who tells you that, which part of this huge
juggernaut
of
when we had our son
organisations tells you that?
diagnosed, we would basically, we had him diagnosed by a psychologist.
Right.
And then there's nothing. They just said, there's a support group, parent support group, that's it. There's nothing else for you.
Yeah,
So you go home and you just...
I got kind of diagnosed. Suspicions of me was emotionally unstable personality disorder. I had this meeting back in October, and when I didn't get told that when I left the room, I was led to believe it was just depression. And my mood swings, everything else got worse and worse and worse. And I eventually went back down to the doctors to find out that this report being written, I didn't have a single clue about it until I approached the doctor and said, listen, I'm getting really bad again. Can you put my pills or do something? Because my doctor also knows that I care for my dad. Yeah,
so you have your own issues and you're also caring.
And I was like...
Paul, can I ask you, as a whole experience today, do you think things have gone backwards or have things got better? Or what I'm hearing, it sounds like they've gone backwards, but what's your experience?
Well, I think there are some particular issues about mental health, and there may be people on the panel or in the room who know more about mental health specifically than I do. But it seems to me, in my experience, there's been two problems with mental health. One is that it's a kind of narrow gate to get through because it's a relatively small specialist service, and therefore waiting lists do build up. Years ago, the government came up with this idea of trying to rebalance the health service by having what they call priority groups. So if you knew that you were in a service called priority service, that meant you knew that that had not been a priority service, because that's really basically what they were saying, is that things like mental health and learning disability should now be priorities. But of course, that rebalancing never really happened for the same kinds of complex reasons that it's proved hard over the years to move money from hospital care into community health and social care. And I think we all know the reasons why that is. It looks much more spectacular and controversial if you're making changes to a hospital than if you're making changes to a mental health service or a community team. I always think it's quite telling that the programme that people watch on the BBC on a Saturday night before news and match of the day is called Casualty. You know, we don't all sit there watching a thing called Community Mental Health Team, or district nurse, although of course there have been some programmes about district nurses and midwives over the years. So there does seem to be a system problem, which I guess Tony in particular would know quite a lot about in terms about how we rebalance the health service. The other thing that's always struck me about mental health is that mental health professionals have, to a larger degree than some other professionals, a particular sensitivity around confidentiality. And what mental health carers have told me over the years is that if you have a husband, wife, daughter, parent, whoever it might be, who has an acute mental health issue, the willingness of professionals to speak to you as a carer is considerably less than if you were the parent carer of someone with a learning disability, or you were the husband or wife carer of an older person. The odd one out is dementia, because it seems to me that doctors, nurses, whoever it might be, accept that if one person's got dementia, at a particular stage, they're going to have to start talking to the family carer to get the story. Yeah? With acute mental health, there's still this attitude around that, we mustn't tell the family anything about the illness. And I think it's absolutely fascinating what the history of that is, whether it goes back to some of the ideas in the 1960s that families were the people who caused mental illness, or whatever it might be. But it does seem to me that the barriers in working with professionals that mental health carers have are actually higher barriers than exist in other parts.
As we had a name check for Tony, we'll come to Tony about how we restructured the NHS. I've experienced some of what you're talking about, and I've adopted a couple of children, and the older boy was having issues, and I couldn't get any information as to you're treated as part of the problem. And you're going, I've adopted his son. He's got no parents. I'm trying to help him. And you feel like you're part of the problem, and they're not going to understand that you don't tell the people caring after that, but how's he going to get better? How's he going to... So, Tony, restructuring the NHS seems to be... When did care in the community begin? That wonderful thing called care in the community begin. Always made me go, that's just another way of saying we're spending less money. I mean, is that what's happened? Are the resources so bad, they've been cut back so extremely that there are the numbers to deal with all these issues? Because carers are dealing with a multitude of problems, mental health, illnesses, diseases, there's so many different issues. Where would you start?
Yeah, well, I don't know. I think care in the community as far as mental health services started about 20 years ago or so. I think people forget how awful care not in the community actually was. In fact, and I can remember working in big asylums, as they were at the time, and they were not good places. So I think the service that people get today is much more human than it was before. I think there is no doubt that services do not have as much resource as people would wish to see them have, but that is not the function of the individual professionals or even the people who run the services locally. They have to, as Justin said, you have to run it within the amount of money that's available. So it is quite difficult, and there are things that can be done to try and make services more accessible to people, which I think is what we're talking about. And what I was talking about earlier is much the same thing around physical and emergency services, so making sure that services are delivered close to people's home. We've had years of drifting it into more and more specialised hospitals, and that isn't necessary. And so that's what we're trying to do locally, is to put back close to where people live, easily accessible by increasing the hours that they're available, and by making changing the way in which the professionals in those neighbourhood teams actually behave, and we recognise that that's an important part of it. We will include, as I said, community mental health services in that, because actually, if someone has a physical problem, they've probably got some sort of mental overlay to that. And people who've got a mental health problem often have a physical problem as well. We can't separate the two. We need to look at people as a whole person.
But will your neighbourhood teams be based in the city as it one of the big problems with Lincolnshire, being the second biggest county I think in the country, is that there are a lot of people in rural areas.
Absolutely. And
how will they get this help?
Well, this is what we're trying to do.
Katie, you were about to answer that?
I'm very rural.
You're very rural.
Yeah, because it's hard. I mean, my dad had to go for electrotherapy, which was here in Lincoln, and despite the road from our house to Lincoln being a straight line, it's very hard to get here, and especially when you're a family that does not have income support other than benefits, because they're incapable of work because of their situation. So when you live in a house in the corner of a field, having community it doesn't exist because you're on your own. Like, it's just one house and it's cold.
Is there anybody else in this sort of situation, or are you all in city? Are you all in Lincoln or in the city? So I'm sure there must be a major. I don't know, Paul, you know more. How do you deal with the fact that we have got a lot of people who aren't in city centres, and how do they get the help?
Well, can I just pick up on the mental health one to start with? Because last October, I was elected onto LPFT, which is the Lincolnshire Partnership Foundation Trust, which delivers mental health services. And I've gone on as a carer governor. Now, I'm learning so much about the whole system. And yes, I will challenge and I will ask questions. However, one of the things that they do within the Foundation Trust is they have what they call an issues group. So, again, I can take issues back to that group and get an answer. So if there is anybody here, please, I'm your carer representative on that Foundation Trust. So that's one aspect of it. And again, from the rurality, I sort of hold my hands up because we live in second largest county. We don't have one decent motorway. We don't even have one decent road that runs through. Now, that's on that hand. On the other hand, I will put my hand up and say, I'm not from Lincolnshire. And I think a lot of people in Lincolnshire will say the same. However, I've been here 30 odd years, so it's probably second nature to home. But we do look at Lincolnshire and we sort of look at the serene, the calm, the rurality. But then we look at services and they probably don't match our expectations. So I don't know what the right way is.
But is there something, Paul was saying about something doing something completely different perhaps? I mean,
Yes.
do you need, if you've got, we've just highlighted clearly a problem with GP surgery is not really getting behind the whole caring industry. You've then got obviously a transport problem. Is there not a way, if we're going to think differently, of having it almost feels like you need a sort of caring services roadshow, where you have someone in a van, that you go on certain days, you have a team, that you have to have someone, a team of carers trained by Pauline, but you need a team of people that can almost be going around in some sort of system that you go, if I live in this area, they come to me on that day, something that at least is, I hear all the organisations, but...
See what that says around there?
Right.
What's our strap line?
By
carers,
yes, absolutely.
for carers.
But you need
We
some
actually
funding,
need your voice. We need your voice to come in.
We need to get a sponsor
feed back out.
to fund
To
some of
aggravate
this.
these people.
Yeah.
Ken,
Yeah.
go.
Can I just say, because I'm just the layman here, but going back to the very first question, it doesn't cost any money to say, and how are you? And I don't see how it's so complicated. A carer doesn't actually want to have a 10-minute conversation with the doctor. It could be the newspaper, the news agent saying, how are you? It is that a carer just needs somebody to care. Because you give out all the care, you get nothing back. If it's the bus driver when you get on the bus, how are you? So it is this thing of valuing carers, making it a national, certainly, but certainly as a region, as a county. Let's raise this profile that there's an awful lot of people in this community who are doing this job and they're not getting any recognition. So you should be able, even if everyone in the room, you've got to know someone who's caring. They're not here today. They've not come to anything. They probably will never come to anything. So it's about every man checking for the person next door. If you don't know, you've been looked in, so now you care. You care about carers. You may not meet them anymore. You might not want to meet them today. But the point is, you now care about carers because somebody has drawn that interest, and that's what. So we don't expect the GPs to spend any more money or do any more than they're doing, but almost as a tick list, because they operate on a tick list anyway. The very end can say, and how are you? They may not care, and how are you? But they've asked, and it means somebody took 2 seconds to say, how are you?
Justin's itching to get it, go ahead.
I mean, I couldn't echo those points more eloquently than you have, really. I think it is about the journey really, that we're on together. It's about integration. You know, resources aren't going to get any greater. If anything, they're going to be more pressure going forward. So we need to make better use of the resources we have a different view of that as well. And it is about all working together. You know, from early intervention and prevention to stop the need for certain services escalating.
In the 20 years that I've been caring, I've actually been asked that question once.
Which one?
And how are you?
Oh,
Yeah.
really?
In actual fact, it wasn't and how are you, it was and how was all of this affecting you. And that was by a member of the pastoral services.
And it's not a big thing, and it
No.
doesn't mean you want the
It
person to
reduces
solve
the
anything. You
tears.
don't actually want any services,
No.
but it is a recognition.
This is
And it is a stop point that says, you know what, I'm doing something
Yeah.
that I didn't ask to. I don't want to do this. And you know, there's not a lot of fun in it, but I do it, and I'm dedicated, and I will do it till I drop. And that's what all carers will do. They don't get to change jobs.
No.
You know, if I don't like it, I can't move on, even though my 2 sons sometimes, I think I get a refund. It's not what I signed up for. But I've had to take it on board, and I know that they are carers. So it is that thing of, let's start passing it on. Let's have carers weeks, and let's have bigger, let's be
Well, I
on
think
TV.
also the
Let's
point
stand
is-
up to Colin.
I think also, and how are you? Good, it's there. But I just think also the point, Clive sent me some literature where it said something like 119 billion
Yeah.
is what it costs the economy. So I was talking to some people from the NHS not on the caring side, but this is on the sort of physical injury side. Just in the gym, in Lincoln, as you do, in the sauna, talking to a surgeon who does a hip operation. So I've been doing some work with Age UK, and they were showing me how the hip operations went like this, obviously in the winter, and how much it cost the NHS. And I said, well, let's say for sake of argument, it cost the NHS 100 million for the hip operations over a 4-month period because of the bad weather. How much would it cost to take £100,000 of that, 100 million, to do an awareness campaign, to prevent spending 100 million, spending 20 million? That you could surely apply that argument to so many aspects of the care industry. If you actually said, what is the real cost of your stress and you're caring for somebody else and you've got an illness that you can't get, and the knock-on effect in society that's happening, it must be massive. It wouldn't be that difficult to measure it, and it wouldn't be that difficult to argue we have NHS representatives here, but to actually say to them, look, how much are you spending on this? At the moment, the impression I get is it's kind of being thrown at the problem. A problem that's a huge industry. Your great examples there are people who are saying, hey, we know the stress you're under as carers, and we're providing somebody who's come, but nobody knows we exist because we're not part of the system. So we have to change that. And it seems to me that in this age of the internet, which has a lot of things wrong with it, but there's a lot of things that are right with it in terms of reaching a lot of people quickly. We know that everybody's on the internet. There'll be a lot of old people who wouldn't have a clue. My parents wouldn't have a clue. But you can start with a majority of carers that might have computer access, where you can start to do an awareness campaign of so many of these issues that you seem to be talking about in corners. But Justin,
I mean, in terms of, there's some legislation that's coming along. I don't know if anyone has heard about the Care Act. Yeah. Basically, it makes a carer's assessment a right going forward. And I mean, that's
is this
why
new?
it's new legislation coming in. So, I mean, in terms of that, that's why colleagues in Lincolnshire, like Emma, are working hard to get the services that support that in place.
So how will that translate for this sort of situation? Would it help?
What we're looking to develop is an integrated one point of access for carer support. So that's what we're encouraging people through this strategy to actually contact that single point in the first place, get an assessment through that route. And again, I know traditionally the assessment response times haven't been great, but we spoke to Emma earlier, and that's operating at 100% now in terms of 28-day response rates for that. So that's the one place to go in there. It's early intervention and prevention. If we get the assessment early, then that's the access to the support.
You know, also, I have to disagree with you there. The amount of time that is given, this is allowed for these assessments to happen, is not long enough for people to express how it affects them. I mean, my assessor brings along last year's assessment and says, has anything changed? No, that won't have changed, and that won't have changed, and I know it won't have changed. But that doesn't get out some of the emotion I used to get out when I could sit for an hour with my assessor, and I just poured it all out, and they extracted what they wanted, what they needed, from what I was blurbing.
So that was a face-to-face assessment?
Yeah, that was a face-to-face assessment. I've always had a face-to-face assessment.
Can we pick that up?
Can I just respond, Joe, because your review should not be like you just described it.
Okay.
Well, that's how it happens.
So can I take your details
Yes.
at the end
Yes.
and follow up on that, because it absolutely should not be like, it should be like you described, where you have all that time to offload, and that's exactly what it should be, whether it's a review or a new assessment. So I really need to follow up on that, please.
Yes.
And is that assessment set up by the GP or
No,
is
that's-
that
No, it's set up through the council.
through the council?
The process should be to contact the one point of access, which is the carer support service, through the customer service centre, which details are in the back of here.
And do you all know about this? Yes.
We then, as a council and the CCG's commission, providers then to support that. There's a call centre that we work with through an organisation called Circa, who manage about 50%, is it, Emma, of the first contacts?
Yes, it's around that.
Yeah.
The second thing to play next year.
Yeah, and then face-to-face assessments are actually provided through.
So how big is the team, assuming you've got to get from contacting them to... Yes, please do.
Carers team based within the council, there are now 20 people on that team, of which 14 of them are carer support workers, telephone based. If telephone based service is not appropriate, because obviously that works really well for some people and also well for others, that's when we go out to trusted assessor organisations. So that's always done in consultation with the carer to decide how they want their assessment to be carried out and who is best placed to provide that service. And then they can build that relationship with that support worker, which, I mean, I've got people that I've been working with for 6, 7, 8 years now, and I know them really, really well, and that's the kind of relationship we want to build up. To enable you to feel that, you know, and if you shouldn't have to think, well, I've had my assessment this year, so that's it for 12 months. It should be an ongoing relationship, so you should be able to call on that support when you need to, when it's right for you.
So Claire, the practical question is how many assessors are there?
Altogether, there's getting on for 100 all in all. Obviously, that's through lots of different organisations. They will have different working structures to their weeks, and some will be part-time, some will be full-time, but there should be, even if that worker is only working 2 days a week, there should be a team behind them to support it. So if your worker is briefing and that worker's not at work that day, there should be a team within the office that can help support at that time. and so on. And then the emergency plan is a further backup behind that. So because these wobbles inevitably happen on a bank holiday weekend in the middle of the night, that's where the emergency plan kicks in, and then the emergency teams are there behind that to pick up those out of hours wobbles. But obviously from what you've described, that isn't working as it should for you, and we need to look at that and address that.
Has anybody else had a good experience with assessment?
I have to say my carers assessment and my carers assessment is actually excellent.
What's the name, Chair? Karen.
I had an assessment a couple of months after I lost my husband, and of course I wasn't coping. So she looked into one of those, got me into bereavement counselling. She phoned up a couple of months later, had I been, how was I getting on and everything. I'm very unlucky. Then another one, I had some health problems, I was going to go to the hospital for some check-up. She phoned me about a month afterwards to see how I was, whether it was serious or not. I have some issues with social services, but I have to say the carers assessment has been brilliant in my case. And so, you know,
so the carers assessment team are getting to get it right. Do we
in my case,
anybody else?
Yeah, I recently had a carers assessment and it was brilliant. Mark, he was really, really good, loads of time and everything. And he put me on to Spurgeon's for my daughter, young carers. But I only heard about carers assessment through a friend, so I haven't had one for 9 years. Didn't know anything about it.
Which brings us back to the point we made earlier.
Friend who, yeah, the carers assessment is fantastic, but I just don't understand why we have to stumble across things rather than being...
We need some awareness campaigns. That's at least somewhere where I can help, because what you need is some media splash on this.
Can we pick up on something?
Yes, please.
You Twitter, don't you?
I do.
Tweet.
They understand what
You have to
you
be careful you don't insult them, don't you? I've seen since I've been a tweeter that a nurse called Kate Granger started a campaign within the NHS, and it was about "Hello, my name is." So it was that interaction with the patient. Now then, why can't we, Emma knows what I'm going to say because she can read my mind, why can't we start a campaign that says, "And how are you today, Emma?" Why can't we start something and we can launch it now within Carers Week?
Yes.
It's got to start somewhere.
Yeah, sorry, go ahead.
Hi, Janet Paskin from the Wellhead Centre in Bourne. It all just sounds very complicated to me, hearing all of this. We've got links, carers teams, carers connect, partnerships, and now we've got Care Act. I can understand why carers are so bamboozled by all of this. They don't know who to go to, whether to go to the doctor, whether to go to somebody in the community or wherever they want to go. And pregnancy crisis can phone alternatives, rape crisis have phone lines, Childline by Esther Ranson have a helpline. Couldn't we have a carers helpline where somebody can know what's going on in all of the areas in the country, not just Lincolnshire necessarily, whether they can put them into contact with somebody.
We have all the heads here.
Somebody who knows where they can...
There isn't a phone line, but you'd like one.
Just one telephone number, not all these different telephone numbers. Just one telephone number.
Yeah, there's dozens and dozens of single points of access and lots of kinds of different things. But we just want to have one carers line. So wherever that may be, that one carers line will then funnel and provide the necessary information. So a lot of the time, all carers want is information. They don't want to be referred here, there, they just want to know the answer to a question. So if they can phone one number and get the answer to that question on that number, might be they don't need anything else for 6 years.
Or you could pass their telephone number on to someone and then they can phone that person and then they've got time to listen. They're not paying for the phone call either.
Once a carer's in, as in they've come into the system and they've had their carer's assessment, at that point they kind of have got that single point of access because they've got their support worker who will then provide that service for them. But it's getting them in via a single point in the first place. But at the moment, it's
Claire, I'm assuming this isn't a new observation. So Tony, Justin, you must have heard this request before for a helpline. Is there a way in which this is going to happen? Is it something discussed before? Start with Tony.
I haven't heard of it.
You've not heard it before? Justin?
I haven't heard of the helpline. I'm relatively new in this approach though.
Okay.
But from that, I mean, the other approach that we are taking, which is different from the approach in the past, is actually getting carers representatives to work with us. So when we're actually developing these services now, particularly the front end, so the call centres and so on, that we've actually got carers involved in terms of developing that, so that it's not just organisations we commission to do that for us, but we actually are developing the service at the front end. So again, if anyone's in particular interested in participating in that, then please see me afterwards and I'll take the details.
But that's the problem, is that you kind of want, it sounds like you want a helpline, but who's going to pay for that? Who's going to man that?
Well, I mean, the helpline...
Not but, you're there, you'll do it.
We'll do it.
Okay, so,
We want to
Pauline, and how are you campaign?
And how are you?
I think we have to have an how are you ring our helpline, don't we?
Ring our helpline, can't we?
And see if we can put the two together. But yes, go ahead.
I was going to say, most carers, all they want is a bit of acknowledgement, because the emotions that carers go through are very specific to carers. It's not to say that other people aren't carers that have those emotions, but there are, negative emotions like isolation, not being understood. Telling people you're a carer often does have a negative response. You do often get a negative response.
So people say to you, what do you do? You go, I look after my mother.
Yeah.
And they go, oh right, yeah.
Or whatever, yeah. So I think it would be good for people to become more aware of the negative emotions, because at the end of the day, if you have got these negative emotions, it will have an effect on your health, which again links in with the GPs, because they're not aware of these negative emotions. You don't walk in and say, come on, let's have a look at your health and see how you are, but they often don't say that.
It's fascinating to me from being from the entertainment industry, not from this world, which is the world that we're in, caring. But what's interesting to me is that there is a story that joins all of these things up. If you told the story from the point of, I've got someone I'm caring for, to how this affects me, to what it costs the country, the government, how do you do that? There is surely a dialogue and I just keep seeing as you're all talking, it was a series of short films that start to tell your story, that because there's such a lack of awareness. That seems to be the thing I'm constantly hearing. And it's like, the GPs in their defense are probably not doing the job they should be doing because they don't get it. They don't understand it until it affects them, until their mother is in, or until they're personally drawn into it themselves. It is this sort of world that we all talk about, everyone's getting older, there's more money required, but it's not my problem. Until someone in your family is affected, and then it's not too late, but it's like, oh God, this is really...
And we don't get listened to. There's been a reference to carers as being a secret army. Yes. And I think, that, again, totally undervalued, and fair point, GPs are enough to be getting on with, but from a parent care point of view, schools need to be doing something with all the money they get. They should be part of this support network for carers. You see the mother get to the school gate.
Or we have a young person who wants to back you up, I think.
She's not even, she's come out in her pajamas and you're going to give her the look like, you don't know the kind of hell that she's been through to get that child to the school gate. And then, you're given disrespect, or you're given the attitude of, clearly the child has problems because look at the mother. So...
Go ahead.
How can schools identify a young carer?
The young
schools identify it.
That's what I'm saying.
That's what you're
Schools need to be doing their bit for young carers and for parent carers, because they know the children with special needs and additional needs. So again, like a GP, why aren't they flagging up?
This is what I want.
Parent carers.
If I may.
Katie, shoot.
As schools can identify young carers because I come in and I say, hey, there are these things called young carers, and hey, you might be one of them because this might be happening at home, this might be your situation. And personally within my school, because I've told them to, they've set up a group, and then gradually throughout Louth, all the schools have set up groups dedicated to young carers, where parents are more than happy to come and go if they want to at events that are held. I mean, my school put aside a bit of money so that we could have snacks, so that we could have time. Because school's the only place where young carers are able to just relax for a bit. For 6 hours a day, you're not at home. You're not looking after people all the time, as much as you love them, you just need to get away. So they put aside money for school trips after school, so then that leisure time was extended a bit more than just 6 hours. And I feel like that should be done more throughout Lincolnshire, because I don't think every school has that.
It's in Lincolnshire, share the load.
It's in Louth and the Louth area. So
what you're doing is trying to find a way.
But if you let us know, what school are you at? Arts Home Academy.
Oh, I know that well.
We'll have a word with the head teacher and talk about how we get a champion identified for that school. Yeah.
I just wanted to say, doing the carers assessments, often children can be overlooked as being in a caring role because there's parents who are in the caring role. But I actually do 95% of the assessments I do are face-to-face. And although I don't often meet the children, it's the ideal opportunity to not talk about them being the carers, but the impact it might be having. So I still would signpost them to somebody like Spurgeon's for some support, even though I haven't identified them as a carer or the parents haven't identified them as a carer. They are being impacted on because of the caring environment.
yeah, that's definitely something that, I mean, needs to be addressed maybe in the assessments, because young carers are getting younger and younger. Their long-term impact is getting stronger. You know, as more cared fors are being identified, more young carers are being created, more carers being created. So for every carer that there is, there's likely to be a couple of young carers dotting about. They might not even be able to talk yet, but it's still going to impact them. And that then goes into their mental health, their environment, how they're raised, physical, emotional, social, intellectual, all of that will be affected by it. And I can say that personally, because I probably wouldn't be as thoughtful as I am today had I not grown up in an environment with mental health illness all the time. And it feels like children are overlooked, and it's only when they're referred to a service like CAMS, when it's a bit too late, when they have got mental health issues themselves, that it's addressed that, oh, hang on, you're at home and you've got this going on, why wasn't this addressed? Well, because there's no one to address it.
How many other carers, well, first of all, how many of you are carers? That's quite big. And how many of you that are carers know other carers? Quite a lot. Good. I mean, I don't know, Pauline will help me on this, I don't know how you do your market research in the caring industry, but it just seems logical to me that a great way to start this, to start changing this, is to actually, we've all got, well, we have, most of us I'm sure have email, but it almost feels like there needs to be a set of questions that one asks to go, okay, where do we start? Because Clive sent me some information on, here's the list of things I had down. GPs need to recognise carers. Carers need easy ways to find out about support. Carers need a balanced life to avoid breakdown. Carers need information sent to them in a more versatile, flexible way through leaflets, web, or social media. Carers need to be respected, included, and involved. Carers need emotional support. Carers need a replacement when they've gone and they can no longer care for that person. Carers need easily accessible information regarding financial health. Carers need better information regarding short breaks. Carers need new technologies. Young carers need breaks, training, and employment. Carers learning courses. Carers need a winter plan. Benefits information. So I had this huge list and went, there's a lot of stuff that needs to be done here. Obviously there's organisations set up trying to help, but I think my instinct is you guys are all kind of going, well, actually there's lots of basic things that are just not happening. Surely we need to have a dialogue about that and go, well, what would you like to happen to start maybe through some sort of awareness campaign? We're in an age of reality TV. We do it for everything except something like this that's going to affect most of the country. I think in our lifetime, we'll all be cared for or care for someone else. We need to get that message across. I'm sure that you guys will be the best voice for that, to actually go into the different stories that you're all currently in the midst of, frankly, that will have lots of similar common denominators like that list I just read out. You could almost have a little mini film about each aspect of that. And then it's a question of how do you get it out there? Do you get it to GP surgeries? Do you get it to post offices? Where do you put it? You can't get anywhere with a TV screen. But you want to start with that, you want to start with, but I'm sure there could be some way of, I'll have to talk to Pauline about how we do this. But I think you need a sponsor. You need someone like a Saga, who's at least talking to half the audience, because we know there's a lot of old people that are going to be, that might have a vested interest, coming back to Kim's point, that money rules if there's a financial incentive in it for a sponsor, and Saga, for me, would fit that brief. And I think they also have primary care trusts and so on. So there may be a way of finding someone like that to get behind it, who's maybe Lincoln as the guinea pig, or Lincolnshire, to try and actually change this industry and say, look, we're going to try it here. If we can get it right here, the rest of the country follows. But that might be an incentive to the NHS to say, look, let's divert some of this money that's, at the moment it seems, being wasted and or hemorrhaged, because you're not actually talking to the people who can tell you what you're doing wrong. So, sorry, go ahead.
I just, when you are a carer or you're looking after some people, my son was diagnosed with autism at the age of 9, he's nearly, he's just turned 18. But since austerity came in, instead of having the discussions with CAMs and things like that, about how is this last few months going, etc., it changed from having that conversation with your child in the room, and then the psychologist can talk to the person listening to what is being said about them, and then being able to answer. It's now gone down to computerised questions of how do you feel today and how have you felt this last week on a rated scale of 1 to 10. It's a very closed question, and it was just seemed as if we want you out of the system as quickly as possible because our caseloads are so big. When you then as a carer putting your point of view over, it almost contradicts what your child is saying, because all they want to do is say 10, 10, 10, let me get out of here because I don't want to be here.
Yeah.
And then you make it feel quite silly about sort of saying, well actually, what he said isn't quite true. And so you could then call your son, in the case, a liar. And it becomes quite awkward. And so the way that they've started to discuss things has gone really, to me, gone backwards, because it was more about financial and the amount of caseload people have. And sort of saying, we have to sort of say, yeah, we've had them on this for so long, we can hit numbers 8 to 10, so we can discharge, And that's not just my experience, that's quite a few people that I've spoken to that's had exactly the same.
Do you want to say something?
I myself have been under CAMS, and because I was saying, yeah, I'm doing quite well this month, yes, not too bad actually, I'll put down a 10. They don't know what my definition of a 10 is. My 10 could be, oh, I've got up this morning, I've not felt so bad that I want to stay in bed. That's a 10. Whereas someone else's 10 might be, I've won the lottery. They don't know because it's just a number that you're ticking a box in.
And it's just in the last 10 minutes, it could be, couldn't it, how you feel in that 10 minutes?
Yeah, I mean, my mood could change throughout the session, and it's a set course of session. You don't get it long term, and for them to actually be able to discharge you because you put a 10 a couple of times, like I did, rather than actually assess you, see if you do have something wrong with you, or something that maybe isn't wrong with you but needs to just be helped. How is a number that's quite generic going to
So which organisation is that? You're talking about bad experience? That's who?
That's health.
That's health. Is that very different from you had an assessment, is that a different area?
Yeah, different.
So why are they so different?
Because our role is to support the care, and what Kate is talking about is an assessment for the care for the person with the mental health problem, which, as you were saying, as a parent,
it still impacts on the carer, doesn't it?
You're kind of involved, but perhaps not as involved as maybe you should be because of the system.
What would you suggest could happen here to improve this?
That's
not your area?
No, not at all.
Who would I go to
I
on
will
the panel
pass
that
that
can
to
answer that? Tony?
Well, I'm not sure I'm the right person to answer that either, to be honest, because I'm not involved in the CAMS service, per se. But I think what some people have said reflects the fact that that there is much less money around to deliver services than there used to be, and everybody across the whole system is trying to do things in a way that costs less than it did before. And frankly, some of those, as we've heard, don't really cut the mustard. But that is what people are trying to do.
Which is all the more reason why you do need things to be, there needs to be sort of one place you can go and everything needs to be more centralised, because then you could obviously cut a lot of the wastage, because if it's not working.
But what works for one person
Yeah.
doesn't necessarily
Of course.
work for
Yeah, yeah.
another. And
That's right.
we can't do a one-size-fits-all approach to any of this, because people are people and care
Of
are
course.
people. So I think it has to be very individual, which is one of the reasons we would talk to the carer about how best to do the assessment and who's best placed to do it. But you don't always have that choice in other areas of assessment. So if you're going to see a GP, you're going to see one of a collection of GPs. It's not like you can say, well, I don't really fancy that surgery today, I'll go to the one down the road. You kind of, it's much more difficult for them to.
So if we're talking money, let's bring Liz into this. Liz, from your end, obviously from the benefits side of this equation, what can you tell people today that, what are the most common questions you get, and how are you trying to help where clearly money is an issue?
Well, as we said at the beginning, the benefit system is hugely complicated. There is a lot of information now on the Gov website for those people that have internet access. So that would be the first course of action. But there are also a lot of people out there who are supporting with welfare benefit advice throughout Lincolnshire. So people like the carers team, Rethink, will be able to give benefit advice as part of that assessment, as a discussion. There's other organisations, Age UK, Citizens Advice Bureau. The DWP itself has a visiting service, so if anybody is vulnerable and struggling with a claim to a particular benefit, then we will send somebody out to see them in their own home and help them keep forms, etc. So if you, for instance, ring up to claim attendance allowance, personal dependence payment, and are struggling to complete forms for whatever reason, we can send a visiting officer out. As I say, there are a lot of other organisations who are out there to support in claiming benefit. It's important that the benefit is claimed, however. It is there to help support carers allowance. That incidentally can now be claimed online. It's a very simple claim to carers allowance online. Takes only a few minutes, and there's a claim to carers allowance made. So there's carers allowance, personal dependence payment for the person that's ill, disabled, attendance allowance for somebody who's elderly and ill, disabled, disability living allowance for children still up to age 16. All those three last I've mentioned aren't needs tested in any way, so nobody's going to ask about financial circumstances. It doesn't matter what income you have, what money you have in the bank. They're there to support people who are ill and disabled. It's just a question of accessing the information and making the claim.
Liz, which areas of that would you say were the ones that are most, people mostly don't know anything about? Like the ones you just mentioned, the well needs tested, is that commonly known? Or?
I think it is becoming more known, but it's not always, particularly with the elderly and attendance allowance, they don't realise that it's not needs tested. And yeah, and Claire's just reminded me, pension credit, that is for people over the state pension age, and that's a top-up for state pension, and people aren't always aware of that. It is income related, so it will depend on how much income you have coming in, what your state pension is, whether you have private pensions. But nevertheless, it is available to be claimed for people over pension age. So there's pension credit, which is often forgotten, and the three which aren't needs tested, attendance allowance for elderly, personal dependence payment, and disability living. It's important that you are aware of those and they are claimed when they're appropriate. And carers allowance. It's often forgotten that carers allowance is available. I know it's only £60 a week, which is an insult really, but it is available for people, particularly people who perhaps give up work to look after elderly parents, or people looking after children who have no other source of income. Yeah.
Yes, it was interesting just now to hear you say that the carers allowance is such a low amount per week when, you know, none of us would wish to claim it if we didn't have to, and yet the number of hours we put in, sometimes you have sleepless nights, you're up all day and all night. Is it not interesting that carers are not valued? You're nodding.
But after the problem, isn't it?
Not reflected in the very, very low amount of carers allowance consistently.
And probably leads to a lot of the problems we're seeing in these wonderful documentaries on what goes on in care. If they're getting paid.
How much
If they're getting disrespected, frankly, through the lack of pay.
And to get the carers
They're
allowance,
away.
you have to say that you have to be caring for 35 hours a week or more, and that is a full-time job, isn't it? So to get that, you have to be paid. And once you reach state pension age or receive any overlapping benefit, then it's taken into account.
So carers are being penalised really, aren't they?
It's something that the carers organisations need to keep campaigning for with the government.
How much is unemployment benefit then?
That varies. I think it starts, I've got the figures here somewhere, but it starts about £70.
Yeah, so
it
puts it into perspective.
But it's certainly more.
I just want to take a point from this gentleman here.
Thank you very much. I'm Bert Carmack on the Lincolnshire County Council. I just want to make you aware of a couple of things. First, the bad. The County Council has to find another 10% of its budget. That's about £95 million to cut in the coming year. Now, we will of course continue as much as we can with the provisions we're making. Now, the good part is, about a year ago, by law, we established, as most counties did, of course, a health and well-being board. Now, it's so new that we haven't yet got full instructions from the government about what we're supposed to be doing and prioritizing. Now, we're absolutely confident that if we stress to the government, with your help, that carers are important, they will suddenly get a message. And I would urge you all to contact your county councillors, some of whom are very weak or deficient in their knowledge about carers, as I myself was until very recently, until I got involved in this area. And I am very impressed with everything I've heard, but some of it is, although very important, we're not going to get very far unless we start getting firm instructions from the government, unless they're on our side. And I'm convinced that we can put them on our side, because this is a vital, important issue for everyone who lives here. When you have nearly 10% of your population in this town classed as carers, that's something the government has to take notice of. So I urge you all, get in touch with your county council, tell them to contact the Health and Wellbeing Board so that we can prioritize this, put it on the agendas. I've spoken to some of you about, Pauline, for example, and our issues group, as she mentioned, and Peter, of course, to come along and make a presentation to the Health and Wellbeing Board. I'm sorry to go on so long, but it is an important way to make the government stand up and take notice. And I look forward to your contact with me if you're in my division or any other council you'd like.
I think that's brilliant. Really talking the same language. We want change, and I think we have to lobby the people that have the hands on the power. They want votes. 10% of the county, and that's only the people, as we said before, who've identified themselves as carers. I'm sure you could probably double that figure of those who haven't actually got round to saying, hello, I'm a carer, is doing the job. And if you then look at that across the country, if you want to be cynical with the government, you go, how many votes did you actually start looking after this area of society? What I find absolutely disgusting is the fact that we spend so much money on arms and billions on weapons and wars that, frankly, all they do is kill people. We've got people who are alive, need looking after, and we could sort so many of these problems out like that. And I think that's why I think we do need a combination of lobbying the government of making awareness, of letting people know your stories, of making people actually think about, hang on a minute, this could be me, if it's not already me, because that's the other thing, is a lot of people out there are going to be you. And you will have people out there who happen to be heads of huge corporate companies going, this is happening to my mother or my daughter or my, I want to help. But probably right now, don't even know where to begin, because where do we start? There's so many organisations doing this, and that was the point of that. Yeah, but sorry, Ken.
No, that's exactly what I was saying before. And also, the issue with carers also are people who have dignity and pride. We don't want to live on handouts and be given, meager amounts to try and, which we already do anyway to stretch. But also, similar to the lobbying government, there are businesses and corporations who also need to have that awareness, because there are services that we use, because we're carers, but we're still people. We need our cars washed because we use our cars a lot to transport our children who don't go on the bus, or to transport the elderly. So why isn't someone given a bit of a discount when you have to get a car, so that you have a reason with a car to drive? Or if there were mechanics that would give you a discount to service your car, or if you as a recognised carer could get a discount on your petrol, or if it's a case of carers can't keep on top of the housework, there are companies that could offer, well, if you're a carer, you can have 10% off and have a clean. So again, lobbying organisations and businesses to say, look, because if carers knew that Joe Bloggs was going to give us 10% off, we take our business there. So our money, the meager amounts that we have, and some people have money that they have probably had before they were carers, which means they can't accept the benefits either. So if you have your money, you need to put your money as a carer behind a business that cares for you. So again, raising awareness of the role of carers, but empowering carers to say, well, actually, you're not having my money willy-nilly. If there's supermarkets that will give some discount because our care for eat specific diets and we have to buy things, then why are they not? Because that will save some money as well. So we're not asking the government to give us more money, but some of the responsibility for big businesses, they're part of the community. The discount card system that was started, that could be expanded with a bit more awareness.
We did have that discount.
Yeah, but
scheme.
yeah.
What happened to it? Sorry, can I just say?
Yes, no. We do have a carers discount scheme that we run. It's under review at the moment. We're looking to try and get as many businesses as possible. The problem is getting the businesses to agree to the discount.
But that's the numbers, you see. We need to be going back and saying, do you know how many carers are in this county?
You need to be.
And I think when we started it was about that sort of mushroom effect. So it was about carers actually saying to a business, if I've had a good business off, good service off you, if you're a mechanic, day job, I passed that on, and it was supposed to mushroom to be sort of that, and
we did, but then I suppose in a way it lost its way because we had no way of getting any feedback from the businesses or from the carers who had actually used the scheme, whether they'd been offered the discount.
This is where I think awareness and also the use of technology in an innovative way can help, so that you actually have, we're doing all this in most other industries, in that you have forums and you have people coming back and
also this thing about what's in it for the business. So if you stay at a hotel, you have to get, if you want a 4-star rating, you need to do certain things. So just like schools get a healthy living stamp, if they do certain, some businesses could get a carers. They could have a stamp for caring about carers, and that would be towards promoting their business. That would be able to give them better public relations.
I think
so they could get a carer's mark.
The numbers that you're talking about gives you power, because if you actually say, I've got that figure from what Climate sent me, which was 10% of the county. I think we all agree it's probably a lot more than that. If you do something along those lines, and you do start to go right, okay, as a carer, I'm going to use my voice. I'm going to spend my money in this area with a lot of other carers, because they at least get our argument, they at least understand what we're going through and what we're trying to do. And maybe there was a way of showing, at the end of that, I went to a great talk by Tony Bennett in Lincoln before unfortunately passed away, and there was one argument he was having when my wife said, should the vote be compulsory? And he said, You probably expect me to say yes. He said, but no. He said, because it's not governments that change things. It's individuals getting together with other people. So Pauline's a great example of what she's doing with the charity, but it's you guys have a voice. You have power. You can choose where you spend your money. You can choose what you want to say about what's not happening in this caring industry. But you need a means of doing that, which is why I think you do need some sort of awareness campaign, and I think it's certainly something I can help with. But let's take some more questions, because we've got these rather large brains sitting on this panel who can answer things you're probably dying to know. So, yes, sir.
Hello, good evening. I'm working with Parkinson's and people with Parkinson's condition. And I wanted to do something very simple, and that was create a network for carers of people with Parkinson's condition.
Right.
But actually, how difficult is that? And it's proving phenomenally difficult. Structurally, organisationally, we've talked about the complexity of the system quite a bit in the last hour.
Yeah.
But I just wanted to put people in touch with each other. And that simplicity is proving very, very difficult. Knowing where to start. Last summer I spent 2 weeks putting together a service directory for people with Parkinson's. And that took 2 weeks and 4 sides of paper because of the multitude of organisations. I wanted to do something very similar for carers. But it's knowing where to start. And how do I do it? Where do I start?
Well,
How do I actually put two carers in touch with each other?
But the point you're making about you've got them, so you just did one for Parkinson's, you researched all the information, and then what did you do with it?
Well, we published it.
Right.
We published it in the form of a service directory.
Right.
And that went out to a limited group of people, people on our database, which is about 200.
Right.
But 200 people with Parkinson's in the county is actually, on the database, is actually a small proportion of those probably with the condition. So we're only getting to the tip of things. But I'm very keen, as I say, I'm very keen to try and just do something simple, which is to put 2 people in a caring role in contact with each other. For emotional support, welfare, a chat. But actually, when you try to describe the system is hugely complicated.
Please, can I have the details we've got? Because what we want to do as well, we want to put like-minded carers in touch with each other. It's something we kind of do on an informal basis. So it tends to be more with the rarer conditions, because if you get someone that's got something quite unusual, you think, oh, someone else has got that. And we can't just give you their details. What we can do is ask their permission to do that, and we can then put them in touch with you. So please let me have that, and we can make that information available throughout the trusted assessor network, and it can be part and parcel of what we do then. So if we've got someone that's dealing with Parkinson's, we're happy to then share that information and let them make the decisions whether they want to be involved. No problem.
Fantastic, thank you.
I know I'm not on the panel, but can I say something too? Sorry. The partnership will be a good place to link into as well, and we're starting the carer roadshows in June, and so that will be some really good connections there where you will meet carers and then we can begin to pass that information on. But actually doing it through the partnership is helpful because, as Claire says, then we can pass that information around those existing networks. So if you want to chat to me later, that would be good.
Fantastic, thank you.
I was just going to respond as well, just to say your service directory, the County Council has got a really comprehensive online information and advice service, My Choice, My Care, which would be delighted to have something like your service directory on there. And also the dementia group would be a good place to...
But what I discovered in doing this, there's an abundance of information, there's information complexity, there's information overload, and what I was looking for, information simplicity.
That's the message I keep getting. I can't solve it right now, but I'm running a charity called Making History, which we are going to be bringing back to schools in Lincolnshire. When it's running smoothly, there's a lot of stuff we can do to help in this area, because I'm being supported by Apple and by Google. Now, Google, rather interestingly, give huge amounts of money out for, in fact, anything online, but particularly apps development. So there's a charity out there called Apps for Good, which is actually in schools, but they give kids the brief to go and develop apps about anything they want to do it on, whether it be knife crime, whether it be bullying. They have to come up with a design, and it goes all the way to market. Now, I'm going to have a chat with them, having had this conversation about this. I had talked to Pauline a little bit about this before, saying that if you've got the hard information, because it seems to me that the information's out there, but it's all in corners. If ever an industry needed an app, boy, is it the care industry, because then you could go to the areas that affect you, whether you'd have to divide it into, you know, extreme care, medium care, low-level care, however you do it, so you can go to the bit you want, and then you'd have to have your areas of Parkinson's, mental health, you know, whatever, you'd have to structure it. But it seems to me the information's there, but it needs a team, so you need to almost go and, that's why I had to sit with Paul and go, right, your charity needs to go and get some funding to put a team together that comes back to you guys and asks you a set of questions. So you can start to actually go, what are the most needed areas? Where's it currently going wrong? And you start to put together something along the lines you're talking about, which is one place you can all go to start off. Because also, if you have the one place, and all of you would start to tune into that as kind of, you know, that's the place you go if you want carers information, you have a bigger voice. It's a huge industry, as we said before, 119 billion. They might not be giving you enough money to care for your family, but you're spending a lot of money in this industry, and a lot of it is being misspent. So I think there is room to argue that case. Yes, go ahead.
I know that it isn't really much to do about carers, but what do you class wardens and warden-controlled areas as?
Who wants to say that?
Because to me, I class them as a carer, and I care for my dad sort of part-time. I do all his finances and everything. But say that my dad has a trip, and the warden saw it, and had to get in contact with me. Now that, to me, that's being a carer. Now recently, a few months ago, I had to attend a meeting at my dad's sort of facility because they're cutting the wardens down. And it's like, whoa, what's going to happen with us lot then? If they're going to cut out the wardens, then yeah. Even more of a problem.
A carer is an unpaid family carer. A warden would be paid. Right. And it's as simple as that. It isn't simple, but the definition is that as an unpaid family carer, I am giving my care, whereas the warden would be paid to give that care. And when you say they're being reduced, it's obviously that somewhere along the line their budget is reduced.
Because I don't actually live with my dad. He lives about 5-10 minute walk away. And with this personality disorder, I have low days and I have high days. I have low and high days in one day. And I do find it hard a lot of the time trying to get over to my dad to sort my dad out for what he needs, because I do a weekly shop, make sure that I get Wiltshire farm foods to deliver and everything like that. But then I've also know that I've got carers who go in there in the morning and evenings. And the worst part is knowing that my dad's going downhill. And he's even starting to lash out at carers. What do I do? What route do I turn down?
Again, they are paid care workers going in. I think the point that you're picking up, or
my dad's got responsibility because he can't. He struggles with his emotions and his way is lashing out now.
But the essential point,
issues at home. It's like, what do I do?
We get it. The essential point you're making is that you've got issues and you're having to care up, but you're also having to care at the same time. And there's going to be a whole lot of different stories around that.
Mingled thing, and I just don't know where to turn half the time, and it's hard as well trying to do it.
There's not a simple answer.
There isn't a simple answer, and I think what it does pick up, and I think I've heard it quite a few times, is that where there is a reduction in the cared for service, and I know going way back to when we started the consultation sort of events around putting the carer strategy together, we heard that quite a lot coming through. but the more the reduction in the cared for service was being reduced, then it put more onto the carer. And I think we keep feeding that back, but again, Peter, she collates, with the team, is collating that voice for the carer. That is what the partnership is about. It's about collating that voice that feeds back into the local authority and others, so other organisations, the NHS, etc.
And district councils as well.
Yeah, all those powerful people, including government, that take on board this. I know we haven't got more money, and I know we've got to work smarter rather than harder. And I know what Tony said about the neighbourhood teams, and we've worked with them in making sure that the carer is included in that. And it's very gratifying to hear that come out, that there will be that sort of almost triage for carers, somewhere for carers to go, so that there is. So that sort of going forward, we have tried very hard to tick lots of the boxes. We can't tick them all overnight, and it is a process that we keep driving forward. But I know that Claire will have every day somebody come through. Peter will have somebody come through that says, why haven't I heard about this? And I go back to, I think it's 2007, where I didn't understand anything about it, but all I saw was angry people banging a table, going, this has happened before. And so more and more people come in, and we then build up this momentum. But we need to keep that going. We need to keep that voice live. As Councillor said, we need to keep that going back. The Care Act coming in that you mentioned will actually bring carers into equality almost, in the sense that it will put the carer alongside the cared for.
And also, hopefully, if we can get the voice kind of focused, frankly, you can lead the debate, because I don't know your name from the council. Bert. I love the accent, Bert. I'm going to start osmosing into you in a moment. but what Bert's saying is brilliant. You've got allies like that who are going, hey, look, the government don't actually know what they're doing. They've set something up. They're giving a chunk of money, potentially, but they don't actually quite know what to do because they don't understand it. You can tell them. So there is an opportunity, and I don't know how you get Bert's information, or maybe Pauline can contact you, but I think absolutely start there and tell all of your friends at the carers. We've got just under 10 minutes, so let's take as many... Oh, go.
To the previous question, really, the advocacy, there are lots of services already.
Right.
One of the issues is about knowing about them.
Yeah.
For that particularly, advocacy may be really helpful. So before you go, you need to talk to those ladies up there. Could where you
I need a briefing as well.
This is about being put together.
We'll go to the young lady first. The young boys. Yeah, very young. Sorry?
I'm a carer for my dad and my brother, and although people in the public can't see that, with people with autism, they can't see their problems, they will still stare at them if they're younger, and they'll basically be kicking off and not being happy about things. And I was wondering, as a community, how could we stop that, and how can young carers get an ID badge so that we're a young carer for this person?
Kim, can you answer?
Absolutely. See, this is, again, because we're talking siblings. Siblings get left out. There are some siblings who have not got a disability themselves, but the stigma with, a simple thing of taking your brother to the cinema, then if your life is impacted, you're not going to be able to claim anything. And as a parent here, it is one of the biggest issues. We worry about the siblings. I've got two sons, 15 and 17. They're both on the autistic spectrum. One is stigmatized, one is not. The older boy, is aware that he has a disability. The younger one, Mr. Asperger, he doesn't want to have any discussion about disability. He doesn't want to acknowledge, he won't take support at school. And he now begins with, am I going to have to look after my brother? Now I said, legally, there will be services to look after your brother because he's staying with you, but you are your brother's keeper. So within the home, he is encouraged. Yes, you are going to have to care for your brother, or I will come back and haunt you. Not on my watch. But it is an attitude that, yes, generally, but this comes back to the awareness. We need to recognize, and autism is considered an invisible disability. My boys don't look like they have a disability, but my oldest son will step in front of a car to avoid a dog or a balloon. And he has done that with a lady walking with her dog, and she didn't step aside, and so he stepped in the road. But, you know, that's the issue. So generally, the awareness that there are a lot of people in our society who are vulnerable and struggling.
What do you think, in terms of answering that question, what could we do to improve that, to make it
We go back to school assemblies, and again, you have to make things look cool. And they have to be, instead of, I'm a big advocate of this thing of put real faces, so that we keep hearing about autism. Well, let's see a cool autism person. Let's see a survivor. There are actors and there are famous people who have autism, ADHD, dyslexia. So where are they? They quietly find out so and so. We had a lot of the Olympic medalists. They have disabilities. We need to be using them and encouraging them to support, so that it's okay then to be in school to say, well, did you know so-and-so has ADHD? The guy who, I forgot his name, he's a wrestler, he's had ADHD. And you know, there's some people, so maybe encouraging them to come to school, to have assemblies to talk about disabilities.
So a lot of autism in our industry,
yeah, it's
and
not,
a lot of dyslexia.
yeah, it doesn't need to be a dirty little thing, oh, no, your brother's a bit odd, he's a bit freaky. And it's simple things and being real with
But I think in
each
answer
other.
to your question, that we're coming back to awareness again, because
Yeah.
again, these things are hidden and kind of in corners, and we don't know what's going on. I know loads of actors who are dyslexic, and so they have to learn the script before they even go to audition, because they can't sight read it. But then often they're more gifted in other areas because of their so-called disadvantage. So the point you're making is there are a lot of famous people who have got these problems, who could highlight it and make it sexy and cool.
Yeah, and it's also back to this thing of, you know, a real face, so that if you know, it is very difficult, but having those real conversations, and, you know, the people in positions talk about being transparent, and, well, we need to be transparent from school age and teach young children to be more compassionate, to be more receptive to difference, because you have difference in color of skin, you have difference in ability, you have difference in disability, or I call it different ability. So that awareness needs to start in schools, and back to young carers doing assemblies, and also being able to push for schools to make it part of school life. There will be, because the government's changing things and the special schools are being less, so a lot more children, particularly with autism, they are in mainstream school and they're not getting help. They're not going to be getting the funding and the statement in, so there's going to be a lot more, not less. So yes, it means you stand up for your sibling. You know, it starts with you. You stand up for your sibling and others have to follow.
Come on, and introduce, because we're running out of time. Katie, you want to say something?
People are afraid of what they don't understand. So when you are out with your brother, if someone, because I have a sibling who suffers with dysphoria and anxiety, and that's not a physical thing that you can see, but it happens all the time. She can't go near any balloons. It terrifies her. She will become a mess because there's a balloon, or she becomes so uncomfortable with herself that she can't go anywhere. And people find that really odd and really weird and look at her strangely and make comments. And if they're like, say something out loud, or I notice that they are being rude and disrespectful, quite frankly, don't go out of my way to just sort of push myself on them like, no, you shouldn't feel this way, like this is what happens. But when you come into contact with bullies and they are horrid, all you need to do is try to educate them, but you can only try the best. People won't always accept. As for the Young Carer badge, so that carers are recognised, that's another thing that has been put into place but sort of forgotten. But I'm working especially within schools to try and get more assemblies. If there was a badge, it was a purple star, and it meant that teachers would be told in the staff room, hey, this purple star means the student is a young carer, stuff's going on at home, Don't heckle them for the homework, just ask nicely. Don't be horrible to them because you don't know what's going on, just ask first. It's not an excuse, but it is a reason. So young carers would be identified with that. They would be supported, especially if they ask for help once they were recognised. Because sometimes you'll find a teacher who will actually put effort into you. I, for one, have found one. But it took me so long to find someone who actually cared, who actually wanted to listen. Now you're just a student, you just learn.
What happens with carers I'm asking is a joint question, but what happens with carers at school? Who takes responsibility for a young carer at school? Is there anybody?
Apart from, she just had Spurgeons go in.
They have pastoral care, don't they, in some schools? Someone in
Not
charge of pastoral care or
Some
not?
schools have what's called SENCO,
Yeah.
which is around learning disabilities mainly, and they aid kids that need extra help. But then they're also entitled to care for children who do have stuff going on that may need the extra support. Because I and my sibling are on that spectrum.
We're almost to the end. I think in terms of that one, I think you need to start a campaign. You need to get every school to have a young carer representative at their school. And you should go to your head teacher, whoever your head teacher is, and say, look, I'm going to start this.
I'll help you.
You know,
I'm the ambassador. I go around.
And I'll help you. I'll be working in schools in a few months' time, and I can do some of this stuff. So, you know, we can do this.
Twist his arm.
We can do this. I think you're possibly the last, because I think it's 8 o'clock.
I just want to talk, because I really do feel there's some massive benefits from carer support groups. I believe in them, mine are bragging that they've been very successful, the numbers that go. And it's about promoting them better. We're a very rural county, so sadly there's a lot of people who can't get buses down there. But I think the benefits of going along to, whether it's a children's care support group or for whatever your caring roles from, people share information, I learn something every time I'm in a group. They support each other and they do share and swap numbers. More importantly, they've got a much bigger voice than I have, and because it's exhausting battling anything on your own, I find that as a group we can bring some issues and we're giving them support because they don't feel scared talking on their own. So I just do believe that groups are really important.
And it does seem that, you know, reading that list of what carers need seems to go right across whatever your situation is. Most people are feeling the same things, ignore, not much emotional support, right? So that's why I'm saying if you can almost start with the common denominators.
And also recognising we know of young carers, we know of spousal carers, we know of care carers. So there's also that new group of sandwich carers, which are the ones who are caring for an elderly parent as well as a child. So we need to, when we talk about raising awareness, there are going to be more and more of them. Of sandwich carers, and they're under double pressure. So, and the issue is you can only claim carers allowance once. So if you are caring for 5 children, you still only get carers allowance £60. So if you are caring for 3, it doesn't matter. And that recognition again is, you know, the 35 hours a week is, yes, you get carers allowance once, no matter how many children or how many people you're caring for. And that makes no sense. So that siblings will be doing it. The sandwich carers are the ones that I, again, would like us to keep on the list and keep on your.
Yeah, no, listen, our time is up. I mean, it's for me absolutely fascinating. It's a bit different to being on a TV studio set. It's a completely different world, but I tell you what's fascinating to me is that you're all talking the same language. And I don't think it's that difficult because there is a hell of a lot of money in. I know we all know they're cutting back, but it's a huge area, and it's going to affect everybody. And I think that message has to get out there. And I think we need to get some of you guys on the camera talking about what you're going through, and that's my mission. Because I think you can change this, and I think let's look at Lincolnshire as there's the county to set an example and get it right, because we're all going to be affected by it. So. I don't know, does Pauline have all your information?
We do through all sorts of organisations.
Right, so you have a place to start to do so expect some questions coming your way, but I think that's where you've got to go, because you're all asking for the same stuff. So thank you for coming.
You made a point there.
Did I?
Yeah, you said something.
Oh.
And if anybody picks these up, it says carers together, a voice for change. Colin is absolutely renowned for being a voice. So we've got
That's
the right
what they
guy
say.
for the job.
Yeah.